This is Joe Freudenberger, CEO for Oak Bend Medical Center, coming to you with a Cup of Joe conversation about healthcare topics that sometimes we are not as familiar with as we might want to be. So March is colorectal cancer month. And so in honor of that, I brought in Dr. Nitesh Vachhani, who has been practicing for 17 years here at Oak Bend Medical Center. He happens to be my personal GI doctor, a super guy, and he's going to help educate us on some things documents related to colonoscopies and colorectal cancer that we might not all know. So the first question I have is, at what age should we start getting screening colonoscopies?
Well, this is a very common question that we get because it used to be that everybody at age 50 get colon cancer screening colonoscopies. However, lately there's been a predilection of colon cancer in younger people, and about 5 years ago they changed that age from 50 to 45 actually.
45.
So now the new recommendation set forth is that everybody, whether you're male or female, doesn't matter what the ethnicity, race, everybody at age 45 should get a baseline routine screening colonoscopy. Now, obviously, this is just for preventative purposes, and it can vary based on, if you have other disease processes or other risk factors. But whether you're, the average person at age 45 should get a colonoscopy.
Okay. So, so why is that so important? If I have no history of colorectal cancer or any type of colon disease in my family or myself, what's the benefit I get out of getting a screening colonoscopy at 45?
Yeah, a lot of times I also hear, oh, I feel great. I don't need a colonoscopy. I don't have any symptoms. Well, colonoscopy is a test that we do to prevent colon cancer. We don't do colonoscopy to find colon cancer. We don't want to find colon cancer. The whole purpose of colonoscopies is to find these little growths called polyps, which are almost like little marbles, and remove them before they get bigger and bigger and bigger and turn into colon cancer. So you want to find these polyps and remove them before you develop any symptoms. So this is a completely screening preventative procedure. It's like a mammogram or like a pap smear. Once you have symptoms, at that point you may already have colon cancer, and we don't want to wait until it's too late.
So I listened to you give a talk years ago where you talked about if you're getting regular screening colonoscopies according to the recommended periodic nature, which is not all that frequent. So you're getting it, the first one at 45. What's the next time you should get it? Is it 10 years later?
So if it's a normal colonoscopy, you're good for 10 years.
Okay.
Which is, not very often. Now, if we find polyps or there's a family history, you may have to come back in 3 to 5 years, depending on the personal situation.
So what you told us in that talk was that colon cancer is almost entirely preventable in a normal, otherwise healthy person by doing these screening colonoscopies. On the other hand, if you don't get the screening colonoscopy, what I recall you saying is that colon cancer is kind of a silent disease. It grows there without you knowing it. You're not symptomatic for a while. Is that correct?
Absolutely. So polyps, as you can imagine, will start off as little 1 or 2 millimeter little growths, which you'll never feel.
Right.
And then slowly over time, 3, 5, 7 years, this 3 millimeter polyp will become 5 millimeters, 1 centimeter, 2 centimeters, and you're still not going to feel anything. And then at a certain point, when it gets big enough and it turns into a cancer, that's when you start bleeding, or your bowels change, or you start having pain. And that's when, you start finally getting symptoms. But it takes years and years for that polyp to become a tumor.
So the problem from a patient standpoint, I imagine, is it's silently growing. It's potentially spreading, right? It could have already, by the time that it becomes symptomatic, it may already have metastasized, which means it's spread through other parts of my body. Is that correct?
100%. So, the whole purpose of colon cancer screening is to, remove these polyps before you become symptomatic. So the whole, I feel great, why do I need a colonoscopy? It doesn't really relate to colonoscopies. You want to be symptom-free when you get these done.
Okay. So, so what do you find people tell you as to why they don't want to get a colonoscopy, other than they feel great? What other things
Exactly.
do they
So
tell
there's
you?
obviously some stigma related to colonoscopies. First
Okay.
of all, it is a procedure.
Right.
It requires you, having a instrument which is about the size of a pen, but about the size of this pen, but a little bit longer, inserted through the rectum, and there's a lot of stigma associated with that. And so I think a lot of people are just afraid to get it done. But you are asleep during this procedure, so you don't feel any pain or discomfort. It takes about 20 minutes. It's not a very lengthy procedure. This is not a major operation, And to be honest, also one more thing, insurance covers it. So this is a big thing. So a lot of times cost is a barrier for good health care. And fortunately, 90% of insurance companies will cover this at 100%, meaning
Ah,
that usually you won't have a cost associated with getting this preventative procedure done.
wow.
So those are some of the reasons people don't get it done. And then also, the night before, when you get this colonoscopy done, you have to prep yourself. You have to clean
Right.
out your colon,
Right.
and it's
Right.
kind of annoying because you got to drink this laxative, and which doesn't taste pleasant. Um, but there have been improvements in this laxative as well. It used to be 4-liter gallon of a jug of
Yes.
stuff, but
Yes.
now we have 2 small bottles, about 2 Coke can sizes. So it's a little bit easier to consume. But still, the night before isn't a pleasant experience. But like you mentioned earlier, once in every 10 years, I think it's a small price to pay to get this procedure done.
Yeah. Yeah. Absolutely. Um, so you're going to be asymptomatic until you've already talked about the symptoms that people can look for, but by the time the symptoms come up, that's a
Yeah.
bad sign. Is there anything? Are there lifestyle changes that people can make in conjunction with screening colonoscopies that lower their risk of colon cancer?
So this is, people who've been watching the news and media lately, there's been a lot of, people that have started developing, colon cancer is actually one of the fastest rising cancers in young people. A few celebrities recently have been diagnosed, and it's been kind of all over the media. And people have been asking me, like, why this upward trend in colon cancer, especially when we're getting these colonoscopies done. And I think one of the main things we can do is diet. I mean, unfortunately, a lot of the current youth in our society consumes a lot of food with preservatives and unnatural type of flavors and ingredients. And I think one of the things that we can do is just to eat healthy, eat more organic food, try to stay away from the preservatives. I think doing those things has been shown to improve not just colon cancer risk, but all cancer risk. So I think diet is obviously plays a critical role in
Okay.
this.
And just to kind of summarize, if I'm asymptomatic today, I'm 45 years old, what have you, are there things that would make me a higher risk for getting colon cancer that I should be aware of?
So yes, so obviously family history is very important. You got to
Okay.
get a good, thorough history of anybody in your family who may have had colon cancer. But there's also personal history of polyps. If you've had polyps in the past, or anybody in your family have had polyps, you're higher risk. There are certain diseases like ulcerative colitis, Crohn's disease, that if you have those, you should probably start screening at an earlier age as well.
Okay. So is there anything else I should know about colon cancers, colonoscopies that you'd want to convey to our audience today?
I think just in summary, I think we've discussed a lot of the points, but in summary, colon cancer is a preventable cancer that, getting these colonoscopies and these screenings done, we can prevent this fast increasing colon cancer risk that's been going around. It's paid for by insurance. You're asleep for it, so you don't feel any discomfort or pain, and it's once every 10 years if it's normal. So I think it's a small price to pay for potentially life-saving.
Absolutely.
Yeah,
Totally
disease.
agree with
Yeah.
you. So thank you very much for joining us today for a cup of Joe. This has been fascinating.
Oh,
I've learned some things,
thank you for
and
having me.
it's always good to refresh my mind as to this preventable disease and what we can individually do to address it. So thank you
Joe.
so much for
Appreciate
joining
it.
us. We
Thank you.
appreciate you, and we'll see you on another cup of Joe at next week or whenever you're ready to join us.